In my experience, I would say that about 97% of my clients' health issues are due to unresolved emotional trauma. So, one case that stands out regarding a 36-year-old client of mine, female client, I was shown she had significant unresolved relationship trauma stored in her breast tissues, which was causing cellular immune issues with those tissues. Keep in mind that I make sure that my clients don't share anything with me regarding their health issues ahead of time. So I knew nothing about her at all. She shared that she had been and was aware that she had been diagnosed with breast cancer, was preparing for a mastectomy and wanted to understand the root cause. So this session helped her to understand the emotional component connected to her diagnosis. In a follow-up energy healing session with her, we discussed specifically addressing and releasing those stored emotions. Other root causes are physical and lifestyle factors like injury, surgery, genetics, medications, recreational drugs, allergies, sensitivities to foods, lack of exercise, and environmental influences like plastics, heavy metals, and mold. One case that stands out regarding one of my clients was that I was shown significant long-term respiratory, neurological, and inflammatory health issues. I was also shown that toxic mold exposure was the main cause. She confirmed that she had been experiencing all of those symptoms, so I encouraged her to consult with a physician who specializes in mold-related illness. She later underwent genetic testing, which revealed that she had a susceptibility to mold illness, and she had urine testing that had confirmed the presence of mold mycotoxins in her body. So her doctor then officially diagnosed her with mold illness. The source of exposure was traced back to water damage in her home, and she ultimately had that water damage remediated. So other causes of illness are negative thoughts. I've been shown with some of my clients that their negative thinking and negative self-talk keeps them in a stage of powerlessness, and their body responds to their thoughts as if their thoughts are real, as if it's real. It's important to know that our bodies follow our thoughts. So one client story that comes to mind was about her negative thoughts that were caused by the way her culture treated women and still treats women. This had a profound effect on her beliefs about herself. She was raised to believe she was unworthy, unimportant, unloved, unhappy, and powerlessness. Or she had powerlessness. She felt powerless. By the time we worked together, she was in her mid-70s, and she was speaking so negatively about herself, and it had become so habitual that she was speaking it as if it was the truth. It was simply how she had been programmed growing up. She initially reached out because of long-standing gastrointestinal issues. Without any prior knowledge of her health issues during my assessment, I was shown she had felt oppressed. She struggled with self-confidence, felt defeated, and was deeply depressed. I was also shown what appeared energetically as a void or an absence of energy throughout her entire gastrointestinal tract. In my experience, when I'm shown a void like that in the body, it often correlates with unresolved emotions. The level of internalized negativity was striking with her. She would say things like, "I'm so emotionally hurt that I will never heal." It was so important for me to explain how continually reinforcing those beliefs tends to cause a self-fulfilling prophecy, We discussed the importance of becoming aware of her negative self-talk and for her to quickly interrupt the pattern each time she felt the urge to criticize, diminish, or to say something negative about herself. The work became not only about her physical symptoms, but also about transforming the lifelong narrative she had been carrying about her own self-worth. She quickly understood the importance of making the change. When looking at her large intestine during the assessment, I was shown some concerning dark spots, so I suggested for her to get a colonoscopy. So she then followed up with her doctor to schedule the colonoscopy. Other root causes of illness, spiritual or energetic influences or interferences. This involves deceased humans, entity attachments, and energetic courting. Sometimes I'm shown that my clients have human or non-human attachments or entities or energetic courting that has caused health issues with my clients. I'll discuss this topic or that topic a little bit more in future lessons.